We are going to demonstrate scheduling a treatment plan by scanning for the next available time slot. Note, the patient's name will be displayed on the title bar of the scheduler. Select Scan from the command bar. The appointment procedure dialog box will display. Select the TX lookup button, which will be displayed in purple, indicating the patient has needed treatment entered. The patient's treatment plans and phases will display, along with the needed appointment length, provider, and if the phase is already scheduled, the date of the appointment will be indicated. Select the phase to be scheduled. Procedure description and time units will default, but may be changed on the fly. Click OK. The provider will default. Optionally, this may be changed or added to. Click OK. The next dialog allows selection of specific times of the day or days of the week. A date to start the scan may be indicated, or leave blank to start the scan from the current date. Click OK to continue. The available appointments will display in grid style. The start time of the available appointments will display in gray. Choose a time to place the appointment. Double-click on the time slot, accessing the normal view of the scheduler for the day selected. Place the appointment by double-clicking in the desired time cell position. For appointment tracking purposes, optionally require user operator number and password. The appointment is now saved.